For this part of Section 2, we're going to talk about applications in the curriculum specifically on clinical skills training. So when we think about clinical skills, we're going to watch a video here of how learners oftentimes will use a high-fidelity simulation center that mimics real-world environments such as the operating room or ICU or ER or hospital bed. So it uses a lot of the same equipment that is used in real clinical medicine, but instead of an actual patient, they're using task trainers or high-fidelity mannequins to do so. Much like anatomy labs, these spaces require a lot of physical square footage, and in order to make the anatomy and physiology and clinical scenarios seem real, these mannequins have to be relatively high fidelity. And these high fidelity mannequins can cost upwards of $100,000 up to $150,000 depending on their special needs. Additionally, there's the cost of all the clinical equipment within these spaces to recreate that real learning environment, as well as you can imagine, staff support to run all of this detailed equipment. Now, the quality of learning in these spaces is phenomenal because it almost truly recreates what a patient experience is like. But as you can imagine, this is not a cost-friendly endeavor. However, the value for learning in this space is immeasurable and has become the standard of clinical skills training, both in medical schools as well as residency training programs and post-residency training. So let's take a look at alternatives to full simulation using VR and other modalities. This is a platform called SimX VR, and you'll see in the two images on the right-hand side is the fully immersive VR environment, and you'll see someone performing chest compressions. Now on the left picture-in-picture is the team actually using the VR. Now you'll see that they're working together as a team to work on this medical resuscitation, and you can see these players represented on the screen with the different color avatars. There's a blue avatar, there's a green avatar, a right avatar on the left, and in the foreground sort of a tan or yellow colored avatar. And you can see them interacting and working much in the same way that they would do in a true simulation environment. Now, the one thing that's likely different is in a true simulation environment, they do have the touch and feel of the devices and actually can perform the procedure with their own hands. In here, they're sort of mimicking those actions in a virtual setting. But you can see as they're touching and interacting, they're pulling IV tubing, they're doing other procedures, they're checking a pulse right now, as you can see on the right-hand side of the screen. And they're being able to check for pulses and continue the methodology. So this oftentimes is really good for team training environments and less about the procedural skill, the haptic, the physical skill. You can see that person about to do an intubation where they put a breathing tube in on the far right-hand side of the screen. I'll sort of use my mouse here to highlight that. You can see them going through and doing the intubation, and you can see the hand motion here following what they're doing with their hands. Again, that looked very easy compared to traditionally how it's done. So it's less about the performance of the actual procedure, but identifying that that procedure needed to happen. Here's another example using augmented reality, using the PerSim task trainer put together by MedCognition. And this one is interesting because it's using AR, so it places a hologram in a physical environment. And so what you'll see here is using the Microsoft HoloLens, these are actually paramedic trainees or EMT trainees working on a hologram in an actual ambulance. So it's putting them in their true practice environment, and the hologram right now is having a seizure. So again, they're not able to necessarily touch the hologram, but they can learn in their true environment of the things they need to do to interact with that model and interact with that environment. And so you'll see here that they have a very similar vital sign monitor that mimics what they have in real life, and this shows how the cases are developed by the instructor. So we had mentioned how VR and AR simulation didn't necessarily focus on the procedural skill aspect in both of those previous examples. We're going to actually look at how we can focus on procedural skills themselves. And so this video here, Children's Hospital in Akron, Ohio, is talking about a skills lab that they put on regularly. And so you'll see the use of multiple models, spines that are probably some sort of animal spines that they're working on to learn the tactile skills to perform these procedures. All right. And so you'll see that this is a pretty elaborate setup to learn these procedural skills. There's a lot of physical space required, a lot of expertise in terms of instructors, a lot of specimens, and they're having to use similar operating room or clinical spaces to learn these clinical skills. So while this is probably the best approximation of real clinical training outside of learning on patients themselves, you can see that just by the sheer size and scope of this, it's a pretty elaborate setup and necessarily will not be done every day for these learners to reinforce these clinical skills. So let's take a look at how this is replicated in VR using a platform called Also VR. Now this one is designed primarily for orthopedic surgery and focusing on orthopedic clinical skills. And you'll see here in this environment, it's using multiple different learners interacting with one another, and they're learning how to do orthopedic procedures. And the interesting part with this is you can see how there's this yellow kind of ghost guide that's telling the learners where to put each piece of the hardware and how to interact with it, so that there is that real just-in-time training that happens that allows a different degree of instruction compared to real-world simulation type training. And so this platform is used very heavily for orthopedic surgery training and shows the opportunities available to learners using VR. Similarly, augmented reality can be used in the OR environments to serve as just-in-time teaching or training tools. In this example here using Senti AR, this is actually creating a holographic overlay that is used as a real-time reference for surgeons in an operating case. So the images you see there are sort of what we call guided imagery based on the patient's anatomy. It's often the use of CT or X-ray imaging or MRI imaging that will allow the surgeon to have a little bit more information about the case without having to change their line of sight, and they can interact with that model to help them guide them through the procedure. And finally, when we look at triage training, there's a specific type of triage called mass casualty triage that's important to be learned by EMS, emergency medical services, as well as a number of other medical specialties. And this is designed to learn how to triage or appropriately prioritize patients for treatment in the setting of a mass casualty. And in order to do these types of trainings, you'll see that it has to be pretty elaborate. In this environment here, this is a car accident with a chemical spill, and you'll see just from the pictures that there are multiple firefighters or individuals playing the role of firefighters. In order to make it seem like a true simulation, there are actual vehicles involved and chemicals and sprays, and again, a rather elaborate setup in order to recreate a training environment that is conducive to learning mass casualty triage. So let's take a look at how this works replicated in virtual reality. This is a product created by Ohio State University called First Responder, and this creates a fully virtual environment for an individual, such as a first responder, to go through and learn how to do mass casualty triage. And you'll see them in this overlay example here using different devices to provide immediate care to multiple patients through these different scenarios. And so you'll see in the pictures here how they're doing appropriate triage, and this allows a single learner in an office or classroom setting to recreate an entire mass casualty incident without having all of the necessary components as you saw in the previous images.